Do you often notice small red or purple dots on your skin, especially on your legs, that don't go away when you press them? Or maybe you've had nosebleeds that take longer than normal to stop. These could be signs that your body isn't forming clots the way it should. That might be due to a condition called Immune Thrombocytopenic Purpura, or ITP for short. Think of it like this: your blood has tiny helpers called platelets that rush to any injury and form a plug, like a Band-Aid from the inside. In ITP, your immune system accidentally attacks these platelets, leaving you with fewer helpers to stop bleeding. So even a small bump can cause big bruises. Sound familiar? Let's explore more. So what makes your body attack its own platelets? That's the core of ITP. Normally, your immune system protects you from viruses and bacteria, like a security guard. But in ITP, it gets confused and thinks your platelets are invaders. Why does this confusion happen? Often it follows a viral infection, like a cold or flu. Imagine your body fights a virus, and after winning, the security team still sees danger and starts chasing the wrong guys, your platelets. In children, this often happens a few weeks after a viral illness and may go away on its own. In adults, it can come on slowly and last longer. Sometimes vaccines or certain medications can also trigger this mix-up. But here's the key: ITP isn't caused by anything you did wrong. It's your body just getting its signals crossed. How do you know if you might have ITP? Let's play detective. Have you ever scratched your arm lightly and noticed a big bruise appear the next day? That's a clue. What about tiny red or purple spots on your feet or legs, like a rash, but they don't itch or fade when you press them? Those are called petechiae. Another sign: bleeding gums when you brush your teeth, or nosebleeds you just can't seem to stop. In severe cases, heavy periods or blood in urine or stool could happen. But here's the good part: many people with mild ITP feel totally fine, no symptoms at all. It's often found during a routine blood test. So, if you're often bruising without reason, it's worth asking your doctor, could this be low platelets? Diagnosing ITP starts with a simple blood test called a CBC, or complete blood count, that checks your platelet levels. If your platelets are very low and no other cause is found, such as medicine or another disease, ITP might be the answer. Doctors call this a diagnosis of exclusion, meaning they rule out everything else first. Now treatment, it depends on your platelet count and symptoms. If your count is low, but you are not bleeding much, your doctor may just say, let us watch and wait. But if bleeding is a problem, treatments include medicines like steroids, they calm your overactive immune system, or IVIG, a quick boost to protect your platelets. In serious cases, where nothing works, removing the spleen, an organ that destroys platelets, can help. Think of it like fixing a broken recycling plant that is tossing out good stuff. Most kids with ITP recover fully without treatment, like a glitch that fixes itself. Right now, there's no sure way to prevent ITP because it's linked to how your immune system responds, something we can't fully control. But you can reduce risks. For example, if you've had ITP before, talk to your doctor before getting new vaccines or medications. Avoid activities that could cause injury, like contact sports, if your platelets are low. Use a soft toothbrush to avoid gum bleeding. And if you're feeling under the weather after a cold, watch for unusual bruising. Prevention here is more about smart management than avoiding a single cause, like wearing a helmet when biking, even if you don't expect to fall. Science is making progress. Researchers are testing new medicines that help the body make more platelets, like ramiprostim and eltrombopag. These act like messengers telling your bone marrow, make more platelet helpers. Other studies are exploring how to retrain the immune system so it stops attacking platelets, similar to how allergy shots work. There's also growing interest in using artificial intelligence to predict which ITP patients need treatment and when. Imagine an app that uses your blood data to warn you before a bleeding risk arises. Plus, studies are focusing on long-term quality of life, not just numbers on a lab report. So, while ITP is still a mystery in many ways, science is getting smarter every day.